An advance directive is the way that people 18 years and older can tell us what they would want for medical care should something really bad happen to them and they're not able to speak for themselves. Some of the things that people put in there are they name a surrogate decision maker, a person who would make decisions in the way they would if they were able to make decisions, as well as a little bit about the kind of decisions they might make, things like resuscitation, tube feeding, IV antibiotics, things like that. It's very important in healthcare to be able to know what kind of decisions the person would want and to make sure that the decision maker is making decisions in the way the person would want. A lot of times maybe you've seen something on television when they're making last-minute decisions or emergency decisions, and they try to figure out, well, what is the decision that needs to be made and who needs to make that? And that's what the advance directive can do for us. We really want to know a little bit about who you are, what your values and goals are, whether you're interested in organ donation or autopsy. So the more information you can give us before that time happens and you can't speak for yourself, the better off you are. We also encourage people to make lots of copies of the form so that they can have it and give it to their doctor, their loved ones, their decision makers. Sometimes people, with advance directives, we have an ethics consult service every hospital does, and sometimes there gets to be some conflict with the family trying to determine, are these really the wishes of the patient or not? So we encourage conversation because this is not about the end of life. This is about an emergency or about a case where you have a procedure that you have sedation, where you might be a little bit unable to make decisions for a little while, and you really want to have someone you trust making decisions for you. So sometimes people think, well, I don't want to fill that out because it means that they won't do CPR on me. And it's really about saying what you want or what you don't want in terms of health care. You're never too young to think about this. The age for decision making is 18 years old, but a lot of times teenagers will work with their parents to make sure that their wishes are followed when they have especially a chronic disease where they know what the outcome of that disease is going to be. We encourage everybody to work with their families to make sure that as that disease progresses, their wishes are able to be followed.